This is my albinism project. What happens? Albinism is when you lack melanin, which causes you to have light skin, hair, and pink, light blue, green, gray, or light brown eyes. Melanin is what gives you pigment for all of your color in your body. With the lack of melanin, you do not get the pigment in your eyes, which makes your eyes sensitive to light. Side effects of albinism. People with albinism often have eyesight problems. Some vision effects are extreme nearsightedness, farsightedness, rapid back and forth movements with both eyes, and poor depth perception. People with albinism get sunburnt very easily and are unable to tan. Their body doesn't produce the pigment to make their skin darker to tan. While they are exposed to sunlight, people with albinism are prone to get freckles. What causes albinism? There are a few different mutations that can happen that cause different types of albinism. The 7 genes that can be mutated and cause different types of albinism are OCA1 through OCA7. OCA1 or type 1 causes a defect in the enzyme tyrosinase that affects melanin production. OCA2 results in a defect in the P protein, which helps tyrosinase enzyme function, which causes very little melanin to be produced. OAC3 is rare and is different than the others. OAC3 is caused by a defect in a protein called TYRP1, which is a protein related to tyrosinase. But people with OAC3 can have a substantial amount of pigment. OCA4 is similar to OCA2, where there is a mutation in a protein that affects the enzyme tyrosinase. This protein is called SLC45A2. OCA5 through OCA7 were discovered in 2012 and are very rare. Since they are so rare, we do not really know a lot about their genetic defect yet. How is it inherited? OAC albinism is not sex-linked, and they are autosomal recessive inheritance. This is when you inherit 2 mutated genes from your parents. If both parents have this gene, there is a 1 in 4 chance that the child will have the gene, and a 1 in 2 chance that it will be a carrier. A weird thing is that someone can be a carrier of the gene but not have albinism. What treatment is there? Since albinism is a genetic disorder, there is no cure. People with albinism go to care to try to gain some abnormalities. Some of the things they do are going to an eye doctor and get some prescription to help their eyesight. Another thing people with albinism do is go to a dermatologist for annual checkups to check for skin cancer. They do this because their skin is very sensitive to the sun and makes them more prone to get skin cancer. How is albinism diagnosed? While getting diagnosed for albinism, you get taken through a series of tests. First, you start with a physical exam, checking your pigment in your skin and hair. Once that is done, you get a test on your eyes. The doctor checks for abnormal growths on the retina and to see if there are any other problems with your eye. Next is a simple test. You get compared to your family members. They compare skin, hair, and eye color to see if anything matches up. Lastly, they view your medical history for things like unstoppable bleeding, excessive bruising, and unexpected infections. All of these things are signs of albinism. Who gets albinism? Albinism happens when the X chromosome is mutated. This makes males more prone to getting albinism because males only have 1 X chromosome, while females have 2. If a female does not have both the genetically mutated chromosome and only have 1, they will not get albinism because it is recessive and the other chromosome will show instead. But for males, since they only have 1 X chromosome, they only need 1 for that gene to show. New studies on albinism. The National Eye Institution did a study with the drug nitisinone, which helps increase melanin. They did a study over 18 months with 3 women and 2 men. The researchers noticed a slight darkening of skin and hair over this time period and believe if they start giving people of younger ages, it would help even more.